India has expanded its COVID-19 vaccination drive as new infections surge to the highest this year. Everyone above the age of 45 is now eligible to get vaccinated. The world's biggest inoculation drive aims to get 250 million people vaccinated against the coronavirus by July. But experts say that target cannot be reached unless efforts are massively ramped up. They say new infections continue surging because people aren't following virus safety measures. More than 72,000 new infections were reported today. That's the highest number in 5 months.
It is absolutely important for us to communicate to people that this is not a short-term affair, that at least for the next 4 to 6 months, we have to remain very strongly disciplined.
Neha Punya joins us live now. Neha, can India meet its vaccination target?
Don, from the very beginning, India set for itself a very ambitious target, saying that by August it would reach about 300 million citizens. It started with frontline and healthcare workers in January, then expanded the drive to cover senior citizens and those with pre-existing medical conditions. But nearly 3 months in, it's only reached about 20% of this ambitious target, and it's already expanding this vaccination drive further to cover everyone who's above the age of 45. The government saying this is absolutely necessary because there is now a big surge in cases, and the government says that everyone above 45 should be covered and should be vaccinated in the next 2 weeks. That's a very tall target, and remember, for India, vaccine supply has never been a problem. It has administered as many vaccines locally as it has exported, but vaccine hesitancy have been stumbling blocks in what is the world's largest immunization drive anywhere in the world. According to the WHO, there's been low turnout at vaccination centers. Vaccine hesitancy has been a problem, and to address all of this, the government says it's now going to ask all vaccination centers, both private and public, to operate all 7 days of the week, including on public holidays, and it's hoping this will drive numbers up. But many are saying instead of a targeted rollout, instead of looking at certain sections of the population, the government should simply allow anyone who wants to get a shot to walk in and get vaccinated.
But Neha, what's going on? Because India has one of the world's biggest vaccine drives, we know that, but infections there are rapidly surging.
Absolutely. And, just about 2 months ago, when India started its vaccination drive, it was with a sense of confidence that not only was it being able to inoculate its citizens, it had also, to some extent, conquered the pandemic, because back then the cases had fallen to a record low. But we've seen how things have changed so rapidly. We're now witnessing the biggest single-day jump in COVID-19 infections in nearly a year, the biggest single-day jump in deaths this year as well. And it has been a concern because officials say that people aren't complying with COVID-19 norms. They're not wearing their masks in public. They're not observing social distancing norms like they were a few months ago. Testing has also been a problem. Contact tracing has been a problem, which is why the central government says that the situation in India is going from bad to worse, and states need to be as vigilant as they were back in March last year when the pandemic was just starting out. The other concern, of course, also is the possibility of a mutation in the virus. There are many experts who believe that the reason why cases are surging is because there's a India variant. The government has acknowledged this but not linked the surge to this variant. But experts say they're comparing the current situation in India to what happened in the UK, saying that the surge could possibly be behind this big surge in cases that we witnessed in the last few weeks.
Neha, thank you very much for that update. Neha Punya there in New Delhi.